I've done a lot of work with carers. I've interviewed hundreds of carers over the years, and I'm passionate about carers' issues. Carers are isolated, they lack information, their friends and family disappear when they become carers, and they need a break. Give Us a Break is a multi-level project that will enable carers on a face-to-face level have a break for a weekend using networks of bed and breakfasts. Initially as a pilot in London, but when they go home, the break doesn't stop. We're looking at various online systems, a lastminute.com style system where there might be other opportunities for them to get respite or to meet.
What we're looking at is, I'm working in the West Midlands. You'd never guess by my accent. And I've been involved in care for 29 years, and I'm really, really passionate about dignity. And we've set up this particular project in the region where we're looking at working with as many dignity champions as possible. And it's like a permeation model. But it starts with a steering group, and then it goes through from the steering group into some leads in each of the sub-regions. And then to get more dignity champions. The problem is that there are dignity champions out there, but they don't know what to do, they don't know how to connect. And I got to saying they don't know how to spread good practice. And then it stopped there because the name came. And our name has to come now because we're going to create a dignity garden. Because, I beg your pardon, I never promised you a dignity garden along with the sunshine. There's gonna be a little rain sometime.
There you go.
Okay, so the problem basically is that there's lots of good practice going on with dignity champions, but they can't find each other. They're spread nationally, and actually they want to find each other locally, and they want to share the really good stuff that's going on locally. As Chan says, it's not quite the same as spreading best practice, it's more sharing the seeds of good practice to allow people to grow their own in each region. What's right in one region isn't right in another. So we're thinking about creating a lot of online gardens in each region where you can share seeds of good practice amongst other gardens.
Okay, so our social need is to develop a tool that will help elderly people make new friends with who may actually have special needs, and the tool that we're thinking of developing would provide a secure and easy to use visually simple way for seniors to find friends through the help of their carers.
So what we want to do is, so from my point of view, I want to find my mum new friends. So my dad passed away, she now doesn't have the same social circle, so how do I get her from her isolated stage to meeting more people? So I thought, okay, she can use the internet, she can use email, but she doesn't know how to use social networking. So how do I get her with an online profile? And the idea is that most of us probably have Facebook profiles, probably almost everyone here. Facebook has this little tool called Facebook Connect. Facebook Connect helps you log into other sites. So we'll use Facebook Connect to build a new site where I can come on there, log in via Facebook Connect, add in my mum's picture, so we actually have a dual profile. We have a joint profile on this separate website. And what I want to do next is then to take her to a dual profile.
PK, that's PK's mum.
PK's mum. And what we'll have then is the ability for us to put in our postcode. So I'm in TW4, I put in my postcode and meetup groups in that area pop up. I then click attend, I'm going to be attending this meeting, I then take my mum to this meeting, and the idea is that, being slightly selfish, I want to go out and party myself, so I don't want to hang out with my mum and her friends. I actually get to meet other carers because they all turn up with their mums. So the mums get to hang out over here, and I get to hang out with the carers who are hopefully roughly my age. So the short hop would be Facebook Connect, log in, add in your mum's picture, add in a few details about your mum's picture, click to find out what the local meetup groups are, or local events, click to attend those so your name comes against it, and let's just say the meetup is in a week at a local cafe, you'll know by the end of the week the number of people turning up, you can then see all their profiles, see who they are, so when you turn up to the cafe, there they all are, you say hello, and then you get to meet a whole bunch of carers, and your mum gets to meet a whole bunch of mums. That's it.
I would like to measure my recovery journey.
Okay.
We've come up with something that we can't even begin to implement, or even begin to suggest how you could. We decided to go for a radical idea, and basically the suggestion is that you should be allowed to see your medical records online. Not that you share them with other people, but you can look at them, but you can also add to them. So they're not just something that medical and healthcare professionals can put stuff in, you can put stuff in as well. You can read the stuff that people have put about you and you can challenge what they've said, or you can say that that isn't true, or why are you saying that about me? You can also, at 7 o'clock in the evening when you're trying to make pasta and you've dropped the pan because your hand went all shaky and you know exactly what the problem is, you can write it down then and there into your medical notes. Rather than having to remember it next time you go to the doctor, you come out there and go, oh shit, I didn't say that thing about dropping the pasta pan last Friday. You could potentially post a video in there, you could potentially put pictures in there. So we're not going to build this site in any way, shape or form at the moment because we don't have access to all those kind of things. But we think it's an interesting idea.